Okay, so this is chapters 5 and 6 of, let me get this over here, Exposed and Ignored. All right, how pesticides are endangering our nation's farm workers. Okay, so chapter 5, regulators and healthcare providers lack basic information about pesticide exposure. Farm workers are not the only ones with minimal information about pesticides. Public health researchers, regulatory agencies, healthcare providers, and the public also lack key information about pesticide use in agricultural and rural areas. The number of individuals injured by pesticides and the health effects of exposure. Obtaining this key data could help to prevent thousands of illnesses and injuries each year. All right, so let's take a look at this map here. This is the pesticide exposure reporting map. And so we'll look at the fine print over here. These are the states that are required. So that is the, let me pull the pen up and I'll circle that. So the states that have it required are in the blue. Those that are optional are in the orange. And those that are not required are somewhat green. So I'd like to draw like a quick similarity between there and Illinois. In Illinois there are no reporting requirements. So anytime there is an injury related to pesticides, it is not necessarily required to be reported and therefore may not be recorded. If you look at some of the areas where our food is being produced, let me see if I can clear this screen here, and I want to go back and I want to scroll up just a smidge. All right, so if you take a look at areas where our food is produced, you got California, Oregon, and Washington, Wisconsin up in north, and Michigan. These are areas where we have a lot of our berries and stuff. So there's some good news in some of these areas where a lot of our food is produced. But there's still a lot of things that it needs to be required as we look at this. All right, so let's get back into the reading here. This is chapter 5. All right, pesticide use reporting. An important gap in information available to the public is the amount and location of pesticides applied in the U.S. every year for agricultural production or other uses. The EPA estimates that approximately 5.1 billion pounds of pesticide are used annually in the U.S. This is an estimate and provides no detail or accurate information on the patterns of pesticide use. Such information on a national level would allow the EPA and health researchers to identify risks to human health and the environment. Obtaining this type of information would require the adaptation of a national pesticide use reporting system to collect information on all agricultural pesticide applications. With accurate information on the pesticides that farm workers and their families are exposed to, health researchers and regulators could improve research models to understand the relationship between exposure and illness. Such information would help to improve pesticide regulation enforcement and worker protections and produce data to improve the EPA's decisions about pesticides. The California Department of Pesticide Regulation established such a system for full agricultural pesticide use reporting in 1990. California continues to be the only state that requires detailed reporting on agricultural. Hold on a second. Had a slight interruption, so I'm going to start right here. California continues to be the only state that requires detailed reporting on agricultural pesticide applications and includes information on the name of the product applied, the date, the geographic location, and the amount applied. The California reporting system is effective and functional. This well-established system could serve as a model for the development of a system to report pesticide usage on a national level. Pesticide incident reporting. So there's a difference here, pesticide use reporting and pesticide incident reporting. And I believe this one here is a map of probably both of the reporting requirements. So this, for example, Illinois, there's no use and there's no reporting. So reporting is like if people get sick, and use is if a company's using it, which I find that kind of a little disturbing because we live in a very agricultural state. In fact, we pride ourselves on the amount of agriculture we have here in the state. And so there's a lot of pesticide use in Illinois that may not get reported. And then there may be exposures that are not getting reported either. And part of it is because a lot of it is hard to keep, basically to connect or to correlate to why somebody is sick. All right, so let's go down here to pesticide incident reporting. Many obstacles prevent a complete count of pesticide exposure incidents for farm workers and their families. An EPA study conducted nationwide in the early 1990s suggested that doctors treat approximately 10,000 to 20,000 cases of pesticide poisoning per year, and possibly as high as 40,000. In 1992, the EPA estimated that, including unreported and misdiagnosed incidents, each year farm workers suffer up to 300,000 acute illnesses and injuries from exposure to pesticides. A number of studies suggest that the number of pesticide poisonings is much larger than that actually reported. There are several reasons for this discrepancy. First, there is no national recording or monitoring system for exposure-related injuries. Many states do not require healthcare providers or public health officials to report pesticide illnesses. While 30 states require health professionals to report pesticide poisonings, only 12 have the resources and capacity to actively investigate, classify, and document reported cases. Second, most farm workers do not seek medical attention for mild or moderate symptoms. Workers face many obstacles when seeking medical care for pesticide-related illnesses, including language barriers, lack of access to medical care, lack of information about hazards they face, lack of awareness of poisoning symptoms, and fear of employer retaliation. Finally, clinicians face significant hurdles in identifying and diagnosing pesticide poisonings. Mild or moderate signs of acute pesticide poisoning, such as nausea, vomiting, diarrhea, and skin rashes, are similar to those caused by other illnesses and can be easily misdiagnosed. Most healthcare providers receive minimal education or training on how to identify, diagnose, and treat pesticide-related illnesses. Even if a clinician recognizes a farm worker's symptoms as a result of pesticide exposure, there are currently few clinical tests capable of identifying the pesticide. Accurate and comprehensive data about pesticide poisoning incidents are vitally important in determining worker safeguards and in keeping dangerous products off the market. When the EPA registers or licenses pesticide products, it must consider adverse environmental or human health effects caused by the product. Such information helps to determine the conditions when pesticides can be applied, the safety equipment, and the time lapse between the treatment of fields and re-entry, and the crop harvest time. In a few instances, the EPA has banned or restricted the use of pesticides following reports of serious worker poisonings. A national mandatory pesticide incident reporting system would help to ensure that such data are captured in a comprehensive manner. Medical monitoring. Very little is known about the occupational pesticide exposure of farm workers. California and Washington mandate blood monitoring for agricultural workers who regularly handle neurotoxic pesticides by periodically measuring nervous system effects of exposure to organophosphate and N-methyl carbamate pesticides. Excessive exposure can be detected before symptoms appear. Establishing a national requirement to monitor the exposure levels of workers who regularly handle such pesticides would provide information about occupational pesticide poisonings. Medical monitoring not only protects workers by alerting them to overexposure before overt symptoms present, but also helps to capture pesticide exposure incidents that might otherwise go unreported. Farm worker health research. In addition to the lack of reliable statistics on pesticide use and pesticide-related farm worker injuries, there is insufficient research on pesticides' impact on farm workers' health. Government funding limitations continue to restrain regulation, enforcement, and research on the issue. For instance, the 2008 Farm Bill included language authorizing a pesticide research program which would conduct longitudinal studies of farm workers and their families' increased risk of cancer or birth defects from pesticide exposure. Congress never appropriated funding for this important research. The Farm Bill that passed the Senate in 2012 no longer contains any mention of pesticide research. The WPS requires employers to provide to farm workers and pesticide handlers enough water, soap, and towels to wash their hands on a regular basis and to wash themselves in case of an accidental exposure to pesticides. I'm down here at this point. Current budget proposals seek to provide for less funding for such information. President Obama's budget for fiscal year 2013 eliminated funding for several programs aimed at gathering data on pesticide use and preventing occupational exposure to farm workers, including one, the Pesticide Record Keeping Program at the USDA, which is the sole federal record keeping tool for pesticide applications. It requires certified restricted use pesticide applicators to maintain records of what pesticide is used, when, and where. The data gathered under this program is used by health professionals providing treatment to persons with known or suspected exposure to pesticides. 2. The Education Research Centers were established to help develop and expand existing occupational health and safety training programs and to provide continuing education courses for healthcare specialists practicing in the field. These centers offer an important training forum for clinicians to address occupational health and safety. 3. Agricultural, Forestry, and Fishing program within the National Institute for Occupational Safety and Health was established to identify the most critical issues in workplace safety and health within the industrial sector and to develop goals and plans for addressing those needs. Okay, I just finished right here, and I just want to reiterate that in 2013, that was when Obama was our president, he eliminated funding for those three programs, for the pesticide record-keeping program, so there's no funding for that. He got rid of the education research centers, or did not provide funding for that, and also the agricultural, forestry, and fishing program, which was used to identify the most critical issues in the workplace safety and health. So those three programs lost their money funding in that budget for the fiscal year 2013. I don't know if it's changed since then. I don't have a newer pesticide book, but my guess is it's probably, once it's gone, it doesn't come back. So there you have that. All right, so I'm going to start right here. Given the scarcity of current research efforts on farm work health, programs of this nature should be expanded and fully funded to provide adequate information that will allow the EPA to make informed decisions during the risk assessment process. All right, moving into Chapter 6, Recommendations for Reducing Pesticide Exposure for Farm Workers. Farm workers and their families are exposed to pesticides on a daily basis, in large quantities and over sustained periods. Consumers have become aware of the risks that pesticides pose to their health. We should not continue to ignore the dangers such exposures pose to farm workers' health in both the short and long term. Juana's story. With an intense gaze, Juana describes her childhood experience of crossing the border into Arizona every morning with her parents. They would dress her in multiple layers of clothing to protect her from the harsh rays of the sun. We were always so worried about the sun because in Arizona and Mexico, it was so very strong, or it is so very strong. What I didn't realize was the real danger was actually the pesticides that were all around us. During her first pregnancy in her early 20s, she worked in the lettuce harvest. I was in charge of packing boxes with heads of lettuce. It wasn't heavy work. I just had to be quick. At the time, I didn't know how important it was to wear gloves and protect myself from those pesticide residues. I would lean right into the boxes, breathing those residues in. I thought it was important to do the work as quickly as possible. I didn't realize it was more important to think about protecting myself and my baby. Juana lost her baby when she was well into her pregnancy and even now wonders if her miscarriage was due to working so intensely with a crop loaded with pesticides. About 10 years after her miscarriage, she was diagnosed with lymphoma, and shortly thereafter, her youngest son was diagnosed with the same disease. Our house was, and still is, right along the edges of the lettuce fields. When we started living there, I still didn't know about how dangerous pesticides could be. I would hang the clothes outside to dry in the fresh air, and my son would play in the water that collected in the irrigation ditches. We did not know the risks. Both she and her son have been cancer free for a number of years, but she still fears for their health because they are living in the same house, and Juana continues to work in the lettuce harvest. I try to be so much more careful now. I understand how important it is to wear clothes that can help protect me when I'm working. We drink bottled water instead of the water from our land because I just don't trust it. And I try to have my son play in places that are truly safe for him and won't cause him any more danger. I think it's so important that every single person know about how dangerous pesticides really are. If you are living in our community or any other farming community in this country, you could be at risk because pesticides don't have boundaries. They can freely cross wherever they want, and we all need to know this. Juana's experience demonstrates that that with knowledge, farm workers are able to take precautions to minimize their exposure to pesticide. However, even these precautions are inadequate to prevent all risks, as some exposures are beyond their control. Achieving effective and comprehensive protections against occupational pesticide exposure for farm workers requires swift and sustained action by the federal government. To accomplish this goal, the following recommendations are suggested. Give farm workers and their families the information they need to protect themselves from pesticides. The WPS should be revised and strengthened. The EPA has delayed issuing revisions to the WPS for far too long. Revisions should include 1. Improved and more frequent safety training for workers. 2. A method for verifying comprehension of the information. 3. Improved hazard communication about the specific pesticides they are exposed to, including short and long-term impacts of exposure. And 4. More meaningful enforcement mechanisms to prosecute those who put workers' lives at risk. Require Spanish translations on pesticide labels to ensure that this information can be quickly and accurately explained by supervisors and accessed by workers who have questions about proper usage and safety precautions. Federal and state agencies should work more closely with farm worker organizations to develop effective educational materials and to ensure that workers are fully informed of the dangers posed by pesticides, understanding how to protect themselves and their families, and can exercise their right to a safe workplace. Second one, demand better information about farm workers' pesticide exposures and implement stronger protections for workers and their families. They can do this by requiring reporting of pesticide use and pesticide poisoning incidents on a national level. Such information is necessary to make important decisions regarding medical treatment, public health, and pesticide regulation. Require medical monitoring of workers who regularly handle neurotoxic pesticides to identify overexposures before there is irreversible harm and to understand the human health effects of exposure. Impose no spray buffer zones around homes, schools, parks, and other areas where farm work families can be exposed to dangerous pesticides that are prone to aerial drift. Expand research on the long-term impacts of pesticides to farm worker health on measures to reduce farm workers' exposure to pesticides and on safer alternatives to pesticides. Participants throughout the entire food system need to recognize their responsibility for reducing preventable injuries, illnesses, and deaths from pesticides. Supermarket chains, food service companies, and other institutional purchasers of produce should collaborate with farm worker organizations and growers to reduce health risks to farm workers and consumers. In addition to taking voluntary action, these entities should support stronger governmental protections and oversight to assure that our food supply is safe for consumers and for the people who labor on our ranches and farms. All right, that is it. There's some credits, and that takes us through to the end. This is the website that I got it from right here, farmworkerjustice.org. And I think that will get us to a point where we can do a little bit of discussion.